So Trissie, welcome to Senate Institutions. The floor is yours, and you are free to take us away.
Thank you so much, Senator Benning. I want to thank, so my name is Trissie Casanova. I work for the Vermont Department for Children and Families, Family Services Division. I want to just start off by thanking this committee for taking the time to hear from me today. I'm really glad to see that Senator Mazza is here today as I live in his district. He's my representative.
Well, stop you right there and offer you our condolences.
I love my town, so I can't, no condolences needed. So as I mentioned, my name is Trissie Casanova. I am the chair of the Family Services Labor Management Committee. I want to start my testimony by acknowledging that this committee deals with buildings and infrastructure. My testimony is going to be a blend for the need for physical space as well as policy implications that are going to come from that. I have worked for the DCF Family Services Division for the last 19 years in a variety of roles. For the first 13 years, I worked as a family services worker in the St. Albans District Office. I worked as a child protection worker, a juvenile services worker, and lastly, an investigator. Currently, I am the Deputy Compact Administrator for the Interstate Compact on the Placement of Children and Commission on Juveniles, and I'm the Human Trafficking Consultant for our division. The state of Vermont's system of care, often abbreviated as SOC, is in crisis and is in need of immediate intervention. This intervention needs to include a program where kids can physically be placed that is safe for them, the community, and staff. The system of care includes placements at home with parents, kinship foster placements, foster care, therapeutic foster care, short-term stabilization programs such as DEPO, residential treatment programs, psychiatric hospitals, and detention. In order for DCF's system of care to operate, we need placements that meet the specialized needs of the children in our care. We need all ends of the spectrum and all levels of care in between to be functioning, such as placements with family, foster care, residential treatment programs, and detention. Prior to the COVID-19 pandemic and the closure of Woodside, DCF had more options for placements across this level of care spectrum. While there has always been a shortage of foster homes, it seems that right now this part of our system is also in crisis. There are many factors contributing as to why this could be happening. Caregivers who are immune compromised and cannot take the risk of accepting placements now, caregivers who lost their jobs or experienced hardship through the pandemic, caregivers who have been overtapped and become burnt out or need a break, and the inconsistent access to school and community service providers contributing to foster parents saying no to placements. We do not have enough foster homes who can meet some of our special needs of youth we are serving, as our children and youth are in crisis right now. Our community-based services that would normally serve these kids in the community, such as therapists, mental health providers, services through our designated agencies, wraparound services, mentor programs for youth, respite and childcare, are also at a diminished capacity due to COVID-19. When Woodside closed without another program ready to take the delinquent population, it created a significant gap in our system and bottleneck in other parts. Kids who previously would have been placed at Woodside are now being placed at DEPO, and those who cannot be placed at DEPO based on the severity of their behaviors and or because of diminished capacity are being staffed at a variety of locations. Those youth in our care without placement, wondering where they're going to go in the same way we are scrambling to find solutions for where to place them, and they deserve better. That is causing a significant gap in our system and data reporting. DEPO has become our only staff secure placement for high-end system of care youth and children. They are serving kids.
Just so I can jump in right here. DEPO, I do understand what that is, but I don't think our viewers do. And if you could explain where that is and what its original purpose was, as opposed to what it may be attempting to be used for now, would be very helpful.
Absolutely. So DEPO is one of our contracted short-term residential programs that we have here in the state of Vermont. It is located in the town of Bennington. They have one program that serves girls and one house that serves boys. It is a staff secure program. It was initially intended as a short-term 7 to 10 day stabilization program. That was the initial intended purpose.
And for senators, for your edification, Senator Sears will be happy to tell you about his affiliation with that program many, many years ago. Thank you. Sorry to interrupt you.
No problem. Depot has become our only staff secure placement for these high-end system of care children or youth. They have been serving kids who have acute mental health problems and youth who have significant history of violence and criminal behavior. Their staff are being assaulted on a regular basis, and COVID outbreaks have significantly diminished their capacity to the point that DCF has needed to send in our own staff into Depot to help maintain the staffing ratios in order to keep the program open. Last week, you heard that only 4% of youth that DCF serves are delinquent. Unfortunately, that data does not fully capture the population we are serving. The population we are serving includes youth who are engaging in violent and delinquent acts, not limited to the use of firearms and drug trafficking. Frequently, there are stipulations made in court that change the youth status with the department. Sometimes those youth are now in our system and are captured as beyond the control of their parents or guardians based on these stipulations. Those stipulations don't change the behaviors they are exhibiting or the risk they pose to themselves or others. In January of 2020, a family services worker from the St. Albans District Office was sexually assaulted by a youth in DCF custody who was being staffed at a hotel due to a lack of placement. After this assault, a team of family services staff, formerly referred to as the Sweet 16, was formed. Their roles range from family services workers, supervisors, directors, and numerous central office staff, myself included, to help staff high-end system of care youth who are without placement. DCF also created a process of high-end system of care huddles and meetings that include a minimum of 6 staff to include central office consultants, directors, supervisors, operations managers, director of operation, our deputy commissioner, and workers. This totals up to about 15 to 20 staff per meeting in order to brainstorm out-of-the-box ideas as to where these children or youth could be placed on an interim basis. One youth alone required 32 meetings. Safety for these youth, staff, and community have to be taken into consideration, and many times one of those entities' safety was compromised. Since then, Family Services Division staff have provided over 400 hours of staffing high-end youth who did not have an identified placement. Those staffings were taking place at police departments, Yellow House in Hyde Park, hospitals, or Horizons Apartment in Bennington. Some of those staffings would include law enforcement in order to increase safety, while some only had 2 DCF staff. Many of those youth had recently been assaulted, committed serious crimes, been discharged or denied from in-state options due to their behaviors, or had been waiting for access to the Brattleboro retreat. These 400 hours are in addition to the staff working their 40 hours a week. Our staffing of particularly violent or high-risk youth require the support of law enforcement. Over the last year, we have been dependent almost solely on the Lamoille and Windham County Sheriff's offices for these details. They have bent over backwards to try to assist us. Unfortunately, many times they don't have the staffing to continue to hold up our system of care. We have in essence been using them for safe and secure detention in alternative settings. At this time, their capacity to continue to support us has been significantly diminished due to their staffing shortages. In 2020, there were 187 times that DCF staff were called in after hours to staff youth. And in 2021, DCF staff were called in after hours 170 times to staff youth. Many times these youth were staffed by the high-end staffing team. However, when there was not capacity within that group for staffing, these requests for staffing would go out to the Family Services All email alias. Even our director of operations has been called in to help provide staffing. When we have to sit with youth at police stations and hospitals and other locations, it puts further strain on other systems within the state of Vermont that we rely on. It also strains our relationships with community partners when we are occupying a bed at a hospital that is likely needed for someone else or occupying space in a police department. For example, this past fall, I agreed to staff a youth at a police department under the condition that law enforcement would be present since that youth had recently been charged with assault with a deadly weapon. Within a few hours of being there, I was told that the police department did not have the capacity to sit with us due to their own staff shortage. And if they got a call, myself and that youth would be moved to the lobby to sit with this youth alone. I did not feel safe when that happened and requested that another worker be called out to sit with me so that we could provide a 2-to-1 staffing for this youth. This youth was later moved to the lobby conference room at the police station where he slept on the floor while we continued to work to find a placement for him. Shortly after that staffing, WCIX reported that on November 22nd, 2021, 2 17-year-old males who had run away from a group home were brought back to the police station. They were held in a conference room when a fight broke out between the boys. According to the articles, the police intervened and one of the teens became aggressive towards officers, which prompted for a call for backup. One of those youth had previously been staffed by some of our DCF staff earlier that summer. This is the type of data that is missing. We are missing the data about how many kids in DCF custody have gone without placement. The situations we have youth in our care who have engaged in violent and assaultive behavior or in mental health crisis, and we have no place to put them. Those situations are not captured in the data previously provided, and it is those situations that are creating the risk for these children and our staff. While we are staffing a high number of these youth, we are also sending kids home prematurely when there have been no other alternative options or the risk is too great for our staff. And then some would say that the community is then at risk. Some of these kids and youth would have previously been placed at Woodside based on their delinquency status and risk to the community. At this time, all ends of our system are compromised. Some of the programs that were previously listed are only long-term residential programs that require approval from the Case Review Committee. Some of them are currently compromised due to COVID-19, which has resulted in reduced capacity within their programs. While COVID has exacerbated the problem, it is not certainly the only cause. COVID has just further limited program and foster care capacity. We are lucky for a period of time that we had the ability to contract with the Sununu Detention Center in New Hampshire for detention beds. However, it was very difficult to place Vermont youth in New Hampshire for the purposes of detention based on the need for a court order allowing the out-of-state placement. Sununu is not a resource to us at this time, leaving us with zero options for secure detention beds in Vermont. While standing up a detention program now is not going to solve all of our programs, it will reduce some of the pressure to our system and other systems. What we know is that there seems to be a rise in youth committing violent crimes. There has been a significant increase in the number of youth coming into Vermont for the purposes of drug trafficking who are gang involved from other states. Over the last year, we have detained 12 out-of-state youth, a majority who were picked up for drug trafficking charges in which they were found with high quantities of heroin and other narcotics. This is an increase from prior years. As I mentioned, these youth were gang involved and had a history of violence. The impact of COVID on our children and youth mental health is also at an all-time high. We have seen instances of youth coming into state custody for the purposes of placement, youth whose parents have begged for help, done all they could, and the systems have not met them as they should. The bottom line is that our system is in crisis. Our children, youth, our staff, and communities are being negatively impacted by this lack of stability. Everyone has been saying that something bad is on the verge of happening. I'm here to tell you that something bad has already happened and continues to happen. In the last year, we had one of our staff sexually assaulted by a youth in custody. We have had kids who have attempted suicide after being moved from secure placements. We have numerous kids staffed in our offices due to foster home shortages, kids who are being staffed at police stations, hospitals, Horizons Apartments, and Yellow House. This is a disservice to our state's children and youth. DCF wants to be able to safely meet the treatment and placement needs of these children, but time and time again have to settle for less than what's indicated. We have placed kids at home after committing violent crimes or firearm-related crimes because they are too dangerous to be staffed or placed in one of our staff secure programs. We have asked our staff to transport youth who have violently assaulted foster parents and are hoping that nothing bad continues to happen. If something does not change now, bad things are going to continue to happen to the children and youth that we are serving and to our staff, and our communities will not be safer. Earlier this week, an article was published by KXAN Texas reporter Avery Travis. This article was talking about the challenges within the Texas foster care system, and a quote from this article summarizes the crisis we faced here in Vermont. It said, "Core failure in the absence of a fully developed system of care, including home and community-based resources, targeted and well-resourced treatment, and appropriate placement services matched to children's needs. We need a fully developed system of care, which includes all of these pieces, as well as placements where kids who are engaging in violent behavior or crimes involving firearms can be placed safely. What we also need is a in-state secure setting to place youth on the date the violent act occurs. Recognizing this takes time, but we absolutely cannot carry on for another year under these circumstances. We need a stable and adequate location in the northern part of the state that can meet most of the basic needs for storage, beds, clothing, shower, hygiene products, and basic activities to pass time. We need multiple programs that match risk level, safety issues, and treatment needs. We need more crisis and stabilization beds for mental health and behavioral problems. We need guaranteed after-hours transportation. We need 25 temporary staff for after-hours staffing, or 16 temporary staff who can be allowed to be on standby status or contracted to be on standby to respond to high-end staffing needs. These temps would be on a rotation 2 at a time to ensure adequate staffing. We need advanced sitters for hospital-based staffing and a commitment to end the utilization of family services workers and division staff to support high-end placements. We need the commissioner and secretary to hold a listening session with impacted staff. And lastly, the Labor Management Committee requests to be able to meet with Governor Scott so that we can share with him directly the crisis we are in and request his assistance. We need the governor's involvement to help ensure an in-state secure program is open immediately to place youth when they engage in violent behaviors. Thank you.
Trissie, I appreciate your communications here. I've got a couple questions I'd like to start with. Back in 2011, when Irene hit, we had to close Waterbury. And Governor Shumlin at the time had a desire to have a wheel and spoke system set up throughout the state. And as I looked at what was being planned, I realized he was placing a great deal of weight on building brick and mortar in the southern end of the state, while the actual patients were coming from the northern end of the state. And I literally drew out a map of Vermont to demonstrate what the imbalance was. You've made mention about a need in the northern part of the state. Is that something similar going on here with respect to the clientele and where they are coming from?
Well, I do not personally hold the data as to where kids are coming from that we're placing it in Bennington, but I anecdotally believe that that a majority of kids are coming from the northern part of the state, and they're having to be transported 3 hours to get to Bennington to Depot. So if that is data that this committee is seeking, I can work to providing that or I'm making an attempt to get it.
It will be, let me back up a half a step. This committee deals primarily with brick and mortar. There's a crossover between knowing where your operators are and where they might want to be living, as well as where the folks, where they live that are coming into the system. In this case, it's youth at risk. It is helpful to have a map, literally, that demonstrates where those numbers are coming from when we want to think about where we should be building facilities or retrofitting facilities in order to meet the needs of these youth. So that would be helpful information. I also want to relate, though, that this is one committee only, and there are several committees that talk about not just the personnel, but the money going in different directions that may need to be had in order to accommodate. This committee, unfortunately, only has about $124 million in its budget. And it's primarily for all state brick and mortar, and that becomes problematic for some of the requests that are obvious here before me anyway, and what we need to do. So anything you can give us by way of a plat, if you will, of where the state clientele is arising from and where the facilities are that we now have and where they'd be desired. If such a document could be created, I'd love to see what that looks like.
So I don't currently have that information, but I can work on seeing if that, if we have that information, and if not, coming up with that for you, Senator.
I appreciate that. And I did not expect you to bring that with you today, by the way. Committee, any questions for Trissie? I see no hands. Shannon Violette, is that how you say your last name?
Violet like the color.
Violet like the color.
Yes.
You are you are a case aide with DCF.
I am no longer a case aide. I used to be a case aide, but I'm currently an FSW out of the St. Albans office that does investigations and assessments.
Okay, so when you say FSW, could you tell us all what that actually means?
Yes, it's the designation of basically the social worker or family services worker, as we refer to it, as the on-the-ground workers who are doing the work in the communities.
Okay. The floor is yours, and welcome to Summit Institutions.
And I thank you so much for allowing me the opportunity to be here. As I kind of already said, my name is Shannon Violette, and I have been a family services worker with the Department for Children and Families for approximately 2.5 years now. Prior to that, as I said before, I worked for the department in different capacities, including the case aide position, which is just a position that helps like assist social workers in their daily roles. And also I did a year-long internship that served for my bachelor's degree in social work that I received from UVM in 2019. Kind of like I already stated, my role at the department is what we call in my office an intake worker, which does the investigations and assessments of accepted reports of child abuse and neglect. With that being said, I'm here today to speak with you not as an employee of the department, but as a member of the public and a VSEA union member. When trying to think of what I wanted to present to you guys and how I wanted to present that, I put a lot of thought into that. And I ultimately realized that I could present all the facts in a data form, or I could use more specific anecdotal stories of the crisis situation that we are currently facing in our district offices. And honestly, sometimes I think that is just like as important as some of the like hard facts and data. So even though my role is on the front end and not in the juvenile services world necessarily, the impact of not having enough juvenile and youth services in the state of Vermont has had a trickle-down effect into every aspect of the work that family services does. For example, I spent my entire workday yesterday on how to support a youth who was too unsafe to be at home, and the mom did not want the child home because of these behaviors. And the mom kept asking me and begging me to help their daughter get into a safe and place where she could get treatment for these unsafe behaviors. And unfortunately, I had to tell that mother that that was a really unlikely situation that was going to happen anytime in the near future, because to simply put it, there are no facilities and no placements that can take youth with violent behaviors on an true emergency basis. And that's when social workers end up staffing these youth at emergency rooms, police departments, etc. Recently, when I had to write a CHINS petition, which stands for Child in Need of Care and Supervision. It's what all children who are in DCF custody fall under. It's in statute. When I had to write this CHINS petition asking for a judge to make an emergency decision on whether a youth was unmanageable or not, the planning for how to support this youth was unimaginable. It is not as simple as one thinks right now, as all emergency beds are full. We have discussions about which youth can maybe be removed from the certain program they're in currently to accommodate this other youth to be put in it who may need it more, and which youth is more than likely going to be safe enough to be back in the community. This is an impossible task, trying to juggle whose mental health is better or worse than someone else's at any given time, because really the reality is all of them need the care and that these services can provide them, but our system just can't support it right now. While the entire system of care is being impacted with the lack of resources that are available, the one system that has been impacted significantly is the juvenile justice system and the lack of secure facility in the state of Vermont. Prior to Woodside closing, judges could send both youth with delinquent status and what policy calls as a CHINS C, which I kind of described what a CHINS is in my previous part of like the child in need of care and supervision. And the CHINS is broken down into separate subsections, and C, the specific C just stands for youth that is defined by statute as beyond their parents' control and or presents a safety risk to themselves or other. Because Woodside is not available, youth are being placed at facilities, kind of as Tracy mentioned, that are supposed to be used for short-term emergency stabilization that is only supposed to be the like 7 to 14 days, but it's now being used for the Woodside youth because that is our next level of highest emergency placement care for them. Our stabilization programs are in no way equipped to be staffing youth with violent behaviors safely. These staff are not trained to work with these youth, and these facilities are in no way a secure facility. Recently, youth from my office that were placed at these facilities, which include like Depot, went on run from these programs, which when we say go on run, it means they ran away or like absconded from the programs and were out in the community freely without supervision. Youth who are involved in the criminal justice system in general and in the child welfare system in general are at a statistically higher rate of becoming victims of trafficking, assaults, other crimes, etc., when they are out in the community like that on the run. It's not a safe option. Having staff that have little to no training and working with youth that have violent behaviors, and these youth are staffing these exact youth that have violent behaviors, it's a dangerous situation because it takes a certain skill set to be able to manage those specific youth. When we aren't trained for that, or having people who aren't trained for that staff these youth, it puts the staff and the youth at a very great risk because it's just not a safe situation. Many youth that are involved in our system of care have experienced an unimaginable amount of trauma in their short lives. We see it every day in the cases we work, sometimes passed down for generations. I've done enough training in chronic trauma and neglect to know that most youth and people who experience this amount of stress live in a state of fight or flight constantly. Someone who is constantly feeling under stress like this can ultimately lead to poor executive functioning and reasoning skills, along with coping skills, and people can resort to feeling like they need to protect themselves, and at times this can look violent. Our youth are not exempt from that, and that is, we don't have a place to support them. Do I think that youth with violent behaviors mean to be assaultive? No, but I also don't think that it is appropriate necessarily for those youth and our workers to be staffing them without the necessary experience for that. The unfortunate reality is that as long as we have youth who display violent or aggressive behaviors, we need a secure facility. When our only true secure facility for these youth was subtracted, nothing comparable to that level of care was added. The remaining system of care was expected to take on that weight, and it was unfortunately an unrealistic expectation. Because youth with violent behaviors need a higher level of care, they're being housed at some of the emergency stabilization programs, which again are not meant for that, including when kids are there for a long time, there's no schooling option, no therapy options that can be provided to them, which is also not great. The youth who needed those stabilization programs are being shuffled in and out of foster homes, staffed in hospitals, or sometimes in police stations. I know a specific time when a youth had become assaultive towards hospital staff, was also self-harming, and ended up needing to be put in a chemical restraint to maintain the safety for the youth and the staff in the emergency room. The youth was kept in the hospital even after they were medically cleared because there was nowhere safe for them to go. We definitely put a large amount of stress on that relationship with that specific hospital, which is a constant worry that I'm facing, working with some of our community partners as we continue to put these strains on these relationships. And I worry that unfortunately, if we continue to do that, it's gonna put us in a situation where they're less likely to want to work with us in the future. Despite the hospital pleading for us to find a safer place for this youth, we continue to keep them there as there was literally nowhere to go and they could not maintain safely in a foster home. With that, what that situation pointed out for me is this. As long as we don't have appropriate and secure facility for our youth struggling with violent behaviors, whether it be a family services worker, a community partner, or that youth, someone is going to get hurt, and people have been hurt. A recent event at one of our Vermont facilities supporting these high-end youth, a staff member was severely assaulted by a youth who would have been placed at Woodside with a cast iron frying pan. This severely injured this staff member and placed this youth at further risk of picking up criminal charges. This youth is currently being placed back in the community under GCF supervision due to a lack of a safe and secure placement for them. I don't really think I need to explain further how that situation greatly impacted the staff safety, youth safety, and now how it could potentially have a trickling effect into the community safety of the Franklin County area. Almost exactly 1 year ago today, one of my colleagues was sexually assaulted staffing a youth that was known to have sexually offending behaviors. He was staffed by us because there was no facility with an appropriate level of care immediately available to them. So that was why FSD staff, or family services staff, was asked to do that. I'm one of the first people to volunteer to help out where I can, but to think that I could be called on to staff a youth with aggressive or violent behaviors concerns me. I am not trained for that situation where a youth might become physically aggressive with me, and it is not something that is even offered at our basic foundations training. I worry that if this information was not shared with you all, you would not see how urgent this need is for a secure facility to staff these youth. All I want, and I know all my coworkers want, is to see these youth be successful. When youth are in custody, us workers spend a lot of time getting to know them and getting to know who these youth are as people. I always get asked by friends and family what keeps me going in this difficult work. And every time I think about it, I think of the positive stories of seeing my clients be successful. I worry that the youth in these examples I shared are not being set up for success and that the system currently in place for them is setting them up for failure. Thank you.
Shannon, I'm going to throw you a curveball here.
Hi,
last
I'm ready.
week, we heard a lot of conversation about the court system.
Mm-hmm.
You brought up the fact that a juvenile entering the system, which in my eyes is the court system as well.
Yes.
It begins with a CHINS petition.
Yes, that is
As
correct.
you and I know, a CHINS petition gets filed. The CHINS petition creates a process for the juvenile to run through the court's system.
Yes.
First thing that happens is there's a preliminary hearing, then there is a merits hearing, and if the merits are contested, there's going to be a contested merits hearing. Whether they are contested or not, eventually they end up in a final hearing to figure out what are we going to do with this person now that we have adjudicated them to be CHINS. The
Yes.
court process, as you see it right now, in comparison to pre-COVID, how are we doing with the timing of those cases?
It's not great. Yeah, it's not great. It's very slow. I recently had a situation about a month ago where I was asked to testify at a merits hearing that I had, so for the front end staff, like me as an investigator, we're usually the ones who file those affidavits asking for custody of youth. So I had filed an affidavit at the very beginning of 2019, and I was asked to testify to merits of that affidavit probably about a month ago. And that's like not great because at that time, that's a year and a half ago. And that's like a very long time to be sitting with that. Because usually they were only a couple, merits hearings would happen a few months after the initial filing.
Okay. Committee, questions for Shannon? I don't see any hands. I want to thank you both for coming out this afternoon. We no doubt will be having some more conversation. But again, I thank you for coming along. Trissie, if you could get me some information to try to develop some kind of a plat of the state and what the distribution looks like for present facilities versus incoming patients, that would be most helpful as we discuss brick and mortar locations down the road.